Enteral access misconnections. What are they and how can nurses avoid them? The Joint Commission issues Sentinel event alerts related to healthcare safety. In 2014, the Joint Commission released a statement related to tubing misconnections that had caused patient harm and even death. A misconnection happens when a tube for one type of delivery system is connected to a different, unintended tubing set, such as when an NG is hooked to a Foley. A feeding tube is hooked to a tracheostomy tube. IV tubing is hooked to a feeding tube, or vice versa. Or a feeding tube is hooked to respiratory suction. These connections are possible because of a variety of risk factors. The biggest risk factor is the universal lure connector, which makes all delivery systems compatible. Other risk factors include low lighting, tubing that is not labeled appropriately, and human error. Based on the Joint Commission's statement, there is an international call for change. Soon errors will be less likely because Enteral tubing will only be compatible with other Enteral devices. This is the NFIT initiative. The NFIT connectors will have an inverse connection type that makes them incompatible with all other lure connectors. Until these changes are made, be hypervigilant with your connections to avoid patient harm, because even one death from a misconnection is too many.